Hi there, my name is Linda Gella. I'm Senior Charge Nurse in Community Mental Health Team in Coatbridge. We support, assess, implement treatment for patients with the support of a wider MDT. We've got OTs, psychiatrists, psychologists, and the range of illnesses could be from severe and enduring mental health issues, which is schizophrenia, various psychotic illnesses, mood disorders, for instance bipolar. Some people it can be anxiety, depression management, and basically that's our role. So for ourselves, we look at the psychosocial model as well, so it's not just about medication, it's about how to support people within to improve their mental health. For some people they see nobody. We've got some patients who literally have nobody, and that's where our nursing assistant roles really come in. The nursing assistants, they kind of try to get them into the community, try to integrate them into things, have things, give them a sense and a purpose, and a lot of times that they don't have. In some occasions, that's the only time they go out the house is if they've got that support for the nursing assistant. So we're looking at things to try and promote their own independence, promote recovery, and to get them into the community. I looked at the allotment and tried to get an allotment. So to the nursing assistant support workers that we have, Jasmine and Chris, they kind of looked into that, went down to the allotment, asked if there was a place. Just by luck there was. When they first took it on, it was an absolute riot. So there was a lot of work that had to be done. And again, the people who are instrumental in that is definitely Jasmine and Chris. So they were down there digging, as were some of the nurses down there digging and turning the soil over and trying to get it ready, which they'd done phenomenally well. They also had phoned in local companies, spread it a wee bit further as well, looking for some donations to try and get started. Things like even basic stuff like spades, shovels, anything at all. They've been given quite a lot of stuff, including a big kind of polytunnel, and that has allowed patients to come in to the allotment, be part of that.
My name's Claire Delaney and I'm one of the CPNs that work within the CMHT in Coatbridge. I think one of the probably the biggest benefits is getting people outside, getting people outdoors. We spent so much time during COVID inside and restricted, and so it has allowed people to be out in a green space, in the fresh air, the elements, whether that be good or bad. I think people are seeing the benefits. And also, not everybody has a garden. A lot of folk don't have a garden, so they've never been able to get their hands dirty in the soil before. They've never experienced the benefits of growing food and growing flowers and things like that, and that kind of sense of achievement that comes from nurturing things and seeing things bloom and grow, and that kind of reward for your labour has been a really good incentive, I think. There's relationships built with the other allotment owners, so like the lady in the allotment next to us, really chatty always, so our staff and our patients know them, they know the people that kind of run and help support the allotment. They're always kind of swapping resources. They have been really good in saying, don't plant that there, and here's tips and hints for, because they know that most of us are beginners when it comes to kind of allotment work. So I would say the peer support, but the community aspect of it, the community support as well has been really good and positive. It has been really positive for everybody involved, I think.
My name's Jasmine Clark and I'm a clinical support worker within the Coatbridge Community Mental Health Team. I've never planted a pot in my life until we started down there. It was good to have that relationship with the patients as well, because they had never done anything like that before, so they were quite reassured when I was saying I've never done anything like this either, so we're just learning together. We've got a variety of patients who are able and some who are less able, so we just create spaces for folk that are less able maybe to sit at an allocated space and plant seedlings, bulbs, and then we've got other folk that are able to actually do the digging and maybe ferrying water from one bit to another, and actually building structures like the big polytunnel. From really no talking in one group, and then to the following year, talking to people and just asking questions and wanting to go down. They've actually, through the groups, they've been able to build up confidence. They are now in employment, and just seeing the difference in people, it's just lovely.